my friends. Let's try to answer the pending question from the last class. What do we have to do in order to avoid those bad outcomes that we can have if we apply a non-wanted torque to our teeth? So in that case, and I'm going to show you a very, very interesting example of this. So we have here a situation that I saw in one of my courses. One of my students, he came to me with that situation. Doc, please, prof, come with me and see what's happening in my case. I'm trying to put the arch wire inside the slot, inside the bracket slot, and this is not coming in because it has a huge friction, and I'm not being able to put inside the slot. And that make me thrilled. Wow! Let me take a picture of that. So in this case, if he had the opportunity, if he managed to do this insertion of the arch wire inside this slot, this is the picture, this is the case I'm showing you, this is the example I'm showing you now. If he managed to do that, what was going to happen to this patient? Because this patient didn't have enough bone buckled to the root. So the bone was very thin, and it was very, very close to the root was very close to this thick cortical buccal plate. So what was going to happen in this case? Probably fenestration of the buccal plate and root resorption. So thank God he didn't manage to do that, because it was a very, very bad mistake. So we don't want that to happen. What should we do to avoid that? What should we do to avoid this kind of bad outcome, this kind of side effect? It's not actually a side effect, because if you know that thing happened, I think it's not more like not knowing that this thing can happen. So in this case, it's not a side effect actually, because this is something that he didn't know. Even though he had that class, he didn't know that. So he was trying to insert this arch wire inside the slot. And then when I came to the patient to try to fix the situation, I told him, you have to be aware of that, my friend, because if you manage to do this, you would have a very bad outcome. And I explained him what was going to happen, and he understood, and he told me, I'm so sorry, Prof. He really told me before that, and I'm going to pay more attention the next time. So in this case here, as you can see, we don't have a neutral real torque anymore. So in this case here, we have this inclination of the crown and this inclination of the slot, which is the same of the crown, minus the inclination embedded inside the bracket. But let's think, for example, as a edgewise appliance, being the same inclination of the slot and the crown. So the buccal surface of the crown has some inclination, and the slot will be at the same inclination because it's 90 degrees against its base. So they don't have compensatory inclinations. As we know, edgewise brackets, they don't have compensatory inclinations. So in this case here, for example, just in order to simplify our exercise, our mental exercise, we're going to think of this case using an edgewise bracket, for example. Let's see. So now, as you can see, we have this inclination here, this white dot line. We have this inclination, which is the same of this red line here. So we have now this red line related, of course, to this blue one, because here we have a perpendicular wire, a perpendicular line related to the floor, related to a real horizontal reference. So here we have this line. This line is a horizontal reference, and here we have this perpendicular line related to this going through the center of our crown. So now we have this inclination here related to the vertical, which is the same inclination we have here related to the horizontal. So in this case, we have an inclination of the crown and an inclination of the slot, which are the same because we are using edgewise in this example here. And now we have the inclination of this transverse section of the rectangular arch wire. It's equal to the inclination of the slot. So being the slot inclined, for example, 20 degrees, we have here the inclination of the rectangular arch wire section, the transverse section, the same inclination here. So when it comes inside the slot, it won't apply a negative force because the inclination is the same. And here we have a relative passive torque. So in this case, even though we don't have the inclination, horizontal inclination of the slot, the bracket slot, we will have here a passive relative torque because we managed to do the inclination, the torsion in the arch wire equal to the inclination of the slot. So we managed to do that. So in this case, we won't have a negative interaction. We will have a passive interaction, which we call a relative passive torque. So this is important because sometimes we want to keep this inclination and we want to do we want to adapt the inclination of those teeth in another phase of our treatment. So sometimes you just want to incline a little bit and we do a very little torsion, and this little torsion makes a little, it generates a little couple, a very, very light couple, which will do the inclination that we want. And this is the benefit of orthodontics. We can see what is happening the next time patient come back to our office. So that's why I believe that I have to see my patient every month, because I have to do the compensatory movements. I have to understand what's going on. And when I see my patient every month, I have the opportunity to choose my path. I have the opportunity to change the way things are going or to keep it like it is. But sometimes we have to change. And for that, we have to see our patient. We have to have our mechanics in our hands. We don't let the mechanics to the fate. No, it's not good. We have to have it in our hands, and we have to be the managers of the mechanic. We have to be the kings of the mechanic. We have to do everything in order to adapt to each situation, to each specific situation. So this is what's going on here in a class 1 situation. In a class 1, just to compare now, in a class 1 situation with good inclinations, if we don't apply any torsion to our arch wire, it will be in most of the cases okay, because average inclination of incisors in a class 1 is the same or almost the same, and we have display inside the slot between the bracket, the thickness of the bracket and the thickness of the thickness of our arch wire, and the space inside the bracket. Sometimes we don't apply couple, even though we don't have the same inclination, the couple is not applied because we have display inside the slot. But again, for the sake of our mental exercise here, we're thinking of an absolute situation. Putting a rectangular inside the slot, a rectangular arch wire inside the slot, we are going to generate some kind of movement if the inclinations are slightly different, okay? This is just for us to understand what's going to happen. And we are going to sophisticate our thinking in a few slides, in a few classes ahead, okay? So let's see it in different situations. Let's think, for example, a class 3 patient. What is going to happen when I have these compensatory movements that I achieved in this patient during my sequence of arch wire? I was changing my arch wire every time patient came back to my office, every month, and everything was going fine, smoothly fine, and everything was very, very good at this point. We are still using round wires here. And we used elastics, and everything was very, very good and beautiful inclination, a beautiful occlusion, compensatory occlusion, of course. But now it's the time that I'm going to use my rectangular arch wire. What is going to happen now? If I don't think about this, if I don't know how to do the reading of the torque, the relative torque, if I don't know how to manage it, if I don't know how to assess the relative torque, if I'm not aware of these problems that I told you, what is going to happen in a case like this? For example, I'm inserting here a 1925 rectangular arch wire in this slot, which is 2230 slot. What is going to happen now? Because everything you did till now is completely okay. It's right, it's okay, it's what was meant to be done. But now you are using a different concept here. We're using the concept of generating a couple inside the slot, because you know that round wires don't generate couples. They don't have couples because they are round. They don't have those tips, and they can't generate couples. So in this case now, I have this class 3 patient, and I'm not using the pre-treatment for surgery. I'm not preparing this patient for surgery. I'm doing a compensatory treatment. I'm doing a camouflage. So in this situation, in this specific situation where we have these inclinations, what is going to happen if I'm not aware of this, if I don't pay enough attention and I just insert my rectangular arch wire inside a slot? What is going to happen in this situation to these teeth, to this upper and lower teeth? So in this case here, we have 22 degrees of inclination, and just doing the math again, we have many things to consider. Of course we have, but just for sake of understanding, let's see absolutely like things are here. 22 degrees of inclination, 7 degrees of inclination of the inclination is embedded in the bracket, the upper incisor bracket. So we have a difference of 15 degrees, a 15-degree difference between the inclination of the crown and the inclination embedded in the slot. So in this case, we have this difference. And we have to understand that this difference of inclination, it will apply a different relationship between the arch wire and the slot. Let's see. The lower incisors, they have a difference, also a difference. So we have minus 15 degrees of inclination of the crown, and we have embedded inside the bracket just minus 1 degree. So we have a minus 14 degree difference, okay? So this is important for us. This is important for us because when we do this, and if I don't apply a torsion to my arch wire, to my rectangular arch wire, this is going to happen to my patient. You may not have this amount of problem, but you will generate a problem. You will generate some kind of mistake to the treatment, okay, to your treatment. So we have here, we insert the rectangular arch wire inside the slot, which is 15 degrees inclined related to the horizontal plane. Remember, 15 because we have 22 degrees in this example, and we have 22 minus 7, we have 15 degrees of difference, okay? A 15 degree difference. So in this case, this difference will play a very bad hole in our treatment. It will disturb the position of the incisors, which was very well compensated. The camouflage that you did till now was okay, and now you will do a very bad thing to your treatment. So in this case now, we are applying the same concept here with zero neutral torsion of the arch wire. Is going to be inserted inside your slot, and your slot is very inclined. So this is an active relationship. It's an active relative torque. And this torque, this active relative torque, will do something like this to your teeth. So to the upper arch and to the lower arch, different moments are generated. To the upper arch, we will have a positive, a negative crown torque, and in the lower arch, we will have a positive crown torque. So we had this before, and now we have something like this. Again, this is not what's going to happen in all your cases, because sometimes you have a bracket prescription which has 12 degrees, for example, and you have 20 degrees of inclination. So you have a rectangular arch wire inserted there, but this rectangular arch wire, it has, just going a little bit further here, forward here, we have this play between the size of the arch wire and the slot itself. So we have this play which allows the arch wire to do this without generating a couple, because it's a little bit loose inside the slot. Okay, so but in this case here, we're considering that this is an absolute relationship, so we don't have space generated between the arch wire and the slot. So we will have a very bad outcome, because we are going to generate something like this. What do we have to do? What if we do a torsion in our arch wire which resembles the inclination of the slots, the bracket slots and the anterior segment of our dental arch? So what if I do this? What if I generate this torsion? It will happen that you will generate a very good situation, because you will do the best thing for the case, being the inclination of the arch wire equal to the inclination of the slot, because you don't want to change that. At this moment, everything was okay, and now you don't want to change that relationship, that incisor relationship. We want to keep that. So I can't insert a rectangular arch wire inside the slot without looking at without evaluating in what position it will pass in posterior region, what position it will pass related to the level of the tubes and brackets and posterior region of our dental arch. So in this situation, to have a passive relationship, what matters here is the relative torque. To have a passive relative torque, we can't generate an active relationship. So be aware of that. Anytime you put something inside, a rectangular arch wire inside a slot. So this is what's going to happen. I will apply a torsion to my arch wire, a real torque, which is equal to the inclination of the slot. In this case, 15 degrees. Of course, again, I'm just thinking absolutely here, just thinking as a precise fit of the rectangular arch wire inside the slot. And we know that's not the case in most of our cases, okay? So this is what's going to happen. And this is how I do the torsion in the anterior segment of the arch wire. You will have the opportunity to stop here and go to our videos, to our tutorial videos showing how to do this, and you come back again, you go again, and you go forth, you go back, and you can do this all the time. This is a very good thing in our online courses. You can stop here, you can go back to the concepts that we applied here, you can go back with the practical exercise, and you exercise again. This is something very good for you. And you will have our ebook, in which is everything explained, and the videos related to each point of the ebook and each point of our class here, which I think is very good. I'm really very proud of this ebook and these videos, these tutorial videos. I tried my best to do that. I hope you enjoy. I hope you can do that all the time. Go back, practice, and come back here to the theoretical classes and go back to our practical classes. So do that. You will learn. Do that. So in this case, I have this torsion. I have the real torque, the positive real torque, which has the same sign and the same amount of torsion, of inclination, the same amount as the inclination of the slot. So when I put it inside the slot, this real positive torque inside the slot, real positive torque inside the slot, which has a positive inclination. This positive inclination is the same of the torsion I gave here. So as you can see, when I insert it here inside the slot, the posterior segment at the end of our arch wire here is going to pass at the same height, at the same level of our tubes, of our premolars and canines brackets. So it's a passive relationship, and this slot here, it won't generate a couple here because the torsion is the same, the inclination of the torsion is the same of the inclination as the inclination of the slot. Okay? So hope you understood everything here. In this case, we have a real buckle, or meaning positive torque, and we have a relative passive torque. Okay? Very important. Every time you do this in your patient, you have to do you have to apply this kind of concept. If you don't want to change the inclination, if you don't want to change the position at that point, you have to do this reading of the position. You have to assess the position of the tip of our rectangular arch wire. Rectangular, it's a strong word, rectangular arch wire inside our slot. You do this inside of the anterior slots, the anterior teeth, and you see here in which position it will pass. If you don't want to have any interaction, if you don't want to have an active interaction because you have a passive interaction, if you don't want to have an active interaction here, if you don't want to generate a couple and of course an inclination because of that, you need to do this passive relative torque. So to see that, the height of the tip of our arch wire has to be at the level, at the same height of the tube of the first molar and second molars, okay? This is the most important thing till now. Guys, so this is for me something very important, and anytime I have the opportunity to say to my students, pay enough attention for that, because we can do harm for our patients, we can do something bad to our cases. I always call their attention about this. Pay attention, pay very much attention to that, because if you mistake this part here, you may cause a very bad outcome. Okay? Look at the situation. After that, student of mine called me, we did the torque and we inserted here, and it was completely passive now. Okay, this is what I wanted. Okay, so guys, see you in our next class. Bye bye.